But the first thing we're going to talk about is, how do you know when your dog has a problem? Because this is the thing. A lot of dogs show very small, subtle signs way before a big problem develops, right? So there may be just little changes. It could be changes in behavior. Maybe the dog stops jumping on the couch or into the car or on the bed. Maybe they end up sitting differently, okay, or standing differently or walking differently, but it hasn't progressed to an actual limp. So I'd like to walk you through what I call an initial assessment, so that when you look at your dog, you're looking at him or her with more educated eyes, where you can really spot something before it becomes a big problem. Then you can intervene, and it doesn't necessarily won't progress necessarily to a larger problem. So we don't want to wait until the dog really has a problem, although we still can help them. We want to make sure we catch things as early as possible, right? So, I would say number one, let your gut guide you. So if you think something isn't right with your dog, talk to your veterinarian, okay? So and sometimes it even happens that other people, even professionals, won't see it, but you know something's wrong. So I would say number one, that's super, super important. If you feel that something's not quite right with your dog, be proactive, and get help, okay? Because something probably isn't right. You're probably right about that. And let's just talk about watching a dog walk, right? The common walk in a dog is a 4-beat gait, which means that each of the legs moves independently, okay? So if the dog starts with the left hind, it's followed by the left front, which is followed by the right hind, which is followed by the right front, okay? And that's typical. Now there are some breeds of dog that don't walk like that, that they walk what looks like both legs on each side are moving together. Usually actually the hind touches down a fraction of an instant earlier. But you may have a dog that used to walk in a very distinct 4-beat gait and now doesn't. Now they're pacing. They're doing this. That can often indicate that they're having an issue with their back, okay? So again, these are things to look for. And it's again not to get you all worked up. If your dog has always walked like that, maybe there's nothing wrong. Like I said, certain breeds of dog, a lot of dogs with long legs and short backs will walk like that. The reason being is they don't want to step on their front feet. So just notice, these are things to look for. If you see a change in your dog, you'll be aware of it. Okay. Other things like how your dog sits. Now people think, well, my dog just sits. How do they sit? Do they sit with one leg cocked to the side? Now young dogs will often sit like that. He's kind of doing a little bit of that, right? A lot of times young dogs sit that way. But if your dog used to always sit square and now is all of a sudden doing this, or this, or this, something is probably wrong, okay? And it could be an issue with the knee, it could be an issue with the hip, it could be an issue with the lower back, because they can't keep everything flexed, like the back straight and the hips really flexed at the same time. So these are things that are really important to keep an eye on, okay? You might see changes in the shape of your dog's back. For a lot of dogs, they start getting a rounded appearance in the lower back, okay? So like this area can get rounded. Some dogs get more rounded here in what we call the thoracic area, the rib cage area. So you might want to really start getting familiar, we're going to do this in a little bit, of running your hands down your dog's spine and being familiar with the shape of the spine, okay? And then you'll notice when things start to change. Okay, but you'll often see that, and I've seen those curves in the back really change for the better, really improve again. So it's not necessarily a permanent thing. So these are some things to look for.